we're going to talk about the anterior and posterior cruciate ligament. Or the ACL and PCL. Now, to understand the attachment of the ACL and PCL, we need to, because in the text is given, what is given is a bit confusing. If you have the bone set with you, and if you have the femur and tibia, you can easily understand what is given in the textbook. For those of you who don't have that, I'll just try to explain through these two diagrams. Now, what you're seeing here is the right knee, the right tibia and the right femur, and we're looking at the top view of the tibia on the left and the bottom view of the femur on the right. Okay, so we're looking at the tibia superiorly and we're looking at the femur from a inferior view. Now, the tibia has the medial and lateral condyles, these two structures, and the fibula as well, the femur as well has the lateral and medial condyles. Now, for the tibia, between these two condyles we have what is known as the intercondylar area, that is between the two condyles, intercondylar area. Now, the anterior and posterior cruciate ligaments get their name with respect to their origin from the tibia. So if it's the anterior cruciate ligament, it originates from the anterior part of the intercondylar area, and the posterior cruciate ligament arises from the posterior part of the intercondylar area of the tibia. Now, the course or how these two ligaments get attached is important. Okay, so I'll be talking about the anterior cruciate ligament first. Now, this ligament, it moves upwards, okay, because it's moving from the tibia to the femur, so it moves upwards and backwards and is attached to the posterior aspect, okay, the posterior aspect of the medial surface of lateral condyle. Okay, I know it's a bit difficult to take in, but just remember, it comes upwards, that is understood, and it comes backwards and is attached to the, we have the lateral condyle here, and this is the orientation, this is the medial part and the posterior aspect. So the posterior aspect of the medial surface of lateral condyle. So this is the attachment of the ACL. Now, the PCL is just opposite to the ACL. It arises from the posterior part of the intercondylar area of tibia. It runs upwards and forwards and is attached to the anterior aspect of the lateral surface of the medial condyle of femur. Okay, so I hope that's understood. Now, let's look at the important points under the ACL. Now, as we've mentioned, it is attached below to the anterior part of the intercondylar area of tibia. It runs upwards, backwards and laterally, and is attached to the posterior aspect of the medial surface of lateral condyle of tibia. Okay, I hope that is understood from this diagram here. Now, the function of the ACL, okay, so the name is anterior cruciate ligament, and we named it according to the tibia. So its function is to prevent the anterior displacement of tibia over femur or the posterior displacement of femur over tibia. Okay, so both are the same thing. We're just talking about, we're just explaining it on the basis of one bone. So if you're talking about the displacement of tibia, we talk about the anterior displacement for ACL, and similarly for the PCL as well, we're going to explain that. So the function of ACL, anterior cruciate ligament, is to prevent the anterior displacement of tibia over femur, or this also can be explained as the posterior displacement of femur over tibia. Okay, I hope that's understood. And the final point is, all the ligaments, the anterior cruciate ligament is taut during the extension of knee joint. Okay, so in complete extension, the anterior cruciate ligament is fully stretched. Now, moving on, talking about the posterior cruciate ligament, we said that we've already mentioned that it is attached to the posterior part of the intercondylar area of tibia. Then it runs upwards, forwards and medially and is attached to the anterior part of the lateral surface of medial condyle of the femur. Okay, now its function, posterior cruciate ligament. So its function will be to prevent the posterior displacement of tibia over femur, or the anterior displacement of femur over tibia. And finally, the posterior cruciate ligament is taut or is fully stretched during flexion or complete flexion of the knee joint. So this is about the anterior and posterior cruciate ligaments. And why they are named cruciate is because they form an X-like structure. If you come back to this diagram, these are the anterior and posterior cruciate ligament. As you can see, they form an X, so that is why they are named so, the anterior and posterior cruciate ligaments. So these are the important points under the ACL and PCL.